Apart from its expertise in heart transplantation and assist devices, the University of Pennsylvania Health System offers various programs for preventive cardiology. At Presbyterian Medical Center, physicians witness the devastation of heart disease on a daily basis.
I can't tell you how many patients I see, healthy people who, in the primes of their lives, suddenly had a heart attack and come in to see me and say, tell me why I had this and tell me what I could have done differently, because I never thought that I would be the one to have a heart attack at age 40.
Because of the staggering number of people who suffer each year from heart disease, prevention has never been more important. Dr. Richard Weiss, also a cardiologist, says simple lifestyle changes can add years to your life and your heart.
As Ben Franklin said, an ounce of prevention is worth a pound of cure. If you can start early, eat right, exercise, watch your cholesterol, you can prevent these major problems and actually avoid the need for LVAD, heart transplantation, or any of these fancy and sophisticated things that we need to do.
There are many factors that contribute to heart disease, and most can be prevented. Here at Phoenixville Hospital, doctors are focused on helping patients identify these risks before they cause a heart attack. One of the most critical and least recognized of these is high blood pressure or hypertension.
Hypertension is a silent killer that unless you've had a blood pressure screening, either at your family doctor's office or at a clinic, you may not be aware that you have that either. So there is a percentage of our population that hasn't been screened and therefore doesn't know they have the diagnosis of some kind of cardiac-related problem or cardiac risk factor. The percentage hopefully is going down with educational programs in the communities.
Pennsylvania Hospital also is on the front lines of heart disease prevention. It is not only the nation's very first hospital, it's also one of the most recognized centers for comprehensive cardiac care.
So by comparing the before images to the after, we can say being a cardiologist is full of challenges, but also many rewards. One of the most rewarding pieces is seeing people who come in pain, frightened, having a problem, treating them and getting them to return to a very productive life, enjoying their families and to whatever they did professionally. It's very satisfying. You really have an opportunity to help people and get them to return to an active lifestyle.
Back at the University of Pennsylvania Medical Center, Dr. Morris considers William Davenport's surgery a success.
He did superbly. The anesthesiologists during the case were able to do an echocardiogram that showed us that the right heart was working fine. 20 to 25% of these patients bleed very heavily. Dr. Davenport actually did beautifully and hardly required a blood transfusion. So he was one of our stellar cases that went perfectly. That's why surgeons are eternal optimists. Despite the most catastrophic of complications, we feel that the next patient will be better and that we've learned from the previous patient. So going on to the next day is never difficult.
Now that I've had this procedure, I see life differently, and that I have a second chance.
So what do you say, about 40, 45 minutes?
And less than 5 weeks later, he is already making rapid improvements in his recovery.
Davenport,
I'd like to go, Bert.
how you feeling?
Good, wonderful.
Getting a lot of exercise in.
Oh, she's working me. She's working me.
Stronger and stronger each day. The purpose of our transplant program is not only to give patients an opportunity to live, but really to give them another chance at life. And that means a quality life, being able to participate with their families, to be able to return to work, to be able to contribute to their communities. And it's not just how many lives we save, but how many people we return to their lives.
I feel great. I feel great. I feel like I did 30 years ago.
Because of the growing advancements in medicine, doctors here are optimistic about the future of heart transplantation.
I think within 5 years, we will have devices that we will put into patients that will keep them alive without having to go under transplant.
At the University of Pennsylvania Medical Center, there are currently available investigational left ventricular assist devices for permanent use in patients that are not deemed appropriate transplant candidates.
Just 3 weeks after his transplant, Ron Meyer's strength has greatly increased. He has made a remarkable recovery. Post-surgical tests are conducted to give doctors an idea of the health of Ron's new heart. The feedback is exactly what Ron and his family have been praying for.
Well, as far as you're concerned, today looks like the day. Your echocardiogram looks good. Get treated for the rejection.
I think that for me personally, what gets me through is the fact that we have successes and then we have failures. And it's the successes that kind of give us our strength to go on to the next case. We deal with life and death every day. And I think that being part of a team that can support each other, and we have a multidisciplinary team, we're working together as a family with the family of the patient, that helps us get through the rough times. And then we rally around the successes to help us get through, and we're feeling like, why are we doing this? Why, we struggle. It's the successes, I think, that help us get through the rougher times.
I'll tell you what, I do feel 1,000 times different, at least. It's amazing. The hospital at the University of Pennsylvania, the cardiologists, the nurses, they are great. You know, so caring and everything. They are really one ace of the team. Amen.
For Ron Myers, a second chance at life was possible because of the efforts of hundreds of medical professionals. And of course, an organ donor. If you would like to find out more about how you can become a donor, log on to pennhealth.com right now. You can also chat with some of the Penn cardiac care doctors from this episode. When we come back, scenes from the next Penn Vital Signs.